To join us on Zoom for a quick analysis of this is Dr. Benedict, an epidemiologist and senior lecturer at the University of Ghana Medical School. Dr. Calistego, thanks for joining us. Now, in the first place, you don't seem to agree that evidence of a reduction in active cases brings hope? Dr. Tego, can you unmute your microphone? So what you just saw on air is the breakdown of the new cases as per the date that they were recorded. On the 4th of August 2020, we had 547 new cases. That number has tapered down steadily to 112. That's on the 13th of August, the last reported date. We've also seen a drastic reduction in the number of active cases. That's a number that government has been emphasizing on over the weeks, that every time we get a new update on a number of cases, we find the number of active cases going down. The latest that we have, as we said earlier, is that there are 4 regions which are actually COVID-19 free. There are 4 regions which currently do not have any reported case of COVID-19. All of these issues combined sort of inform this decision that government has made to further ease the restrictions. So, of course, the opening of the border, the air border is not the only change that we are going to see. There's also the increase on the limit of persons who can gather in public places for award ceremonies, for celebrations, and what have you. So we have on our screen now the number of active cases. On the 4th of August, just at the beginning of this month, we had 3,528 active cases. Again, that number has dropped to 1,906. What you want to take interest in is that it has been steadily dropping over the day. So we lost 200 active cases dropped off in one day. Then it's another 300 dropped off in another day. The next day it went down by the next day it went up on the 7th of August. It went up to 3,256, but steadily it has now come down to 1,906. This, according to government, is informing the decision to further ease restrictions. And of course, it goes without saying that President Akufo-Addo is touting his government's efficiency in managing Ghana's COVID-19 crisis, which he says has seen a significant change. Right. So we will now go to Dr. Benedict Calistego. Dr. Calistego, what do you make of this rate of decline in active cases?
Good afternoon to you and good afternoon to your viewers. I hope you can hear me now.
Loud and clear.
Right. I think we need to tread cautiously because what we are being presented with is just part of the picture and not the entire picture. And let me explain myself. Whenever we are given the number of active cases, it would have been useful if we are told the number of tests that are being conducted as well. Because at the start of this epidemic, we were testing aggressively, we were picking up a lot more cases. Our active cases are a direct product of our testing rates. So if we have reduced our testing, obviously we should expect the number of cases we are picking up to also drop. If we decide to stop testing today, give ourselves another 14 days, there will be no more active cases in Ghana per the new rules for discharging patients. Doesn't mean there is nobody with the virus in the country? Obviously not. What we need to be doing or telling the people is that these are the people we have tested. For every disease that can be transmitted, there are 2 groups of people we worry about. One, those who have been diagnosed, we call them the active or known cases. And then those we don't even know have the disease because we haven't tested and diagnosed them. These are the people who harbor the virus, have the capacity to transmit them, but we don't know about them. We call them the carriers. Now, for the active cases, they are not a threat. Because we have identified them, we would put in the necessary precautionary measures, isolate and treat them. However, for those who are harboring the virus and we do not know, they are the threat. And this is what we should be worrying about. Because bear in mind, more than half of even the cases we have diagnosed were asymptomatic. They didn't show any signs and symptoms. So it's possible there are people in the communities who are harboring the virus and are not showing signs and symptoms. So to come out and say boldly that 4 regions have no cases, I find that problematic in the sense that we have not tested every single individual in those regions.
Right.
And therefore, at best, we could say that amongst those who have been tested, no cases have been identified.
Right.
We have obvious limitations when it comes to testing. And we should make this limitation known when we are putting forth our results so that people would interpret these results in the light of that limitation.
Dr. Calistego, quick one there. We know that under routine surveillance, whenever people report to the hospital with symptoms similar to COVID, they will be tested for the disease. Granted, it may not be as rigorous as the enhanced surveillance, which you referred to earlier, can discover asymptomatic people. But those numbers were going up. Those numbers from routine surveillance were going up as well as the numbers from the enhanced surveillance. So if that is going down, is that not an indication that there is something correct going on?
I am not debating the fact that there is something correct going on. My worry is about our interpretation of the data. If you ask us to focus on active cases, for me, that is not a bother. The active cases are not my problem because we have identified them, we are putting in the necessary measures. However, there are communities or there are people within the communities who may be carrying the virus. You talked about routine surveillance, people being picked up when they go to the hospital. For everybody, it's every single person who reports to the hospital, there may be 5 or more people with the same problem who will never report.
Okay.
And there are others who may never show any signs that would warrant them even going to the hospital.
Right.
So we need to tread cautiously. That is my caution.
Dr. Benedict Calistego, thank you very much for joining us. He's an epidemiologist and senior lecturer at University of Ghana Medical School.